This segment is sponsored by Golden Triangle Internal Medicine.
Good evening. Thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. Our first question of the day: what are symptoms for sciatica? Are there stretches or exercises I can do? I have terrible back pain, but I'm afraid to go to a chiropractor. Are they safe? We answer this question a lot, and it has to do with the fact that, unfortunately, we're obese. We're struggling with our weight, and we tend to get degenerative joint disease in our lumbar spine, which is where we carry most of the stress of being overweight. It'll start to encroach on the nerves and will start to cause back pain as well as numbness and tingling that generate pain down the leg, the posterior aspect of your buttock, and even your foot. It's normally going to be burning, worse with standing up, sometimes with prolonged sitting, and certainly sometimes to relieve that you can just get up and move around. But certainly if it gets really severe, you're probably going to need an MRI of your lumbar spine, as well as some medications such as gabapentin or Lyrica or Elavil, just to name a few. Certainly there's physical therapy that works pretty well. You can get a prescription from your healthcare professional to go to any physical therapy outlet and start some physical therapy. But certainly if you want to try a chiropractor, they're healthcare professionals as well, well trained, and they do a very good job in treating patients who have the spinal DJD related to being overweight and sometimes aging. They have other modalities that they can use, such as injections, as well as heat and ice, to name just a few others. And just to remind you, this is flu season, so certainly go out there and get your flu vaccine. You do not have to wait. It's all about that herd immunity and protecting your neighbor from the flu vaccine. So if you have the opportunity, get that right now. And I will see you next week on Ask the Doc.